Hey, my name is Stephanie Taylor, and I am the Director of Quality and Compliance and Risk Management here at Kinston Community Health Center. And today we are going to be joined by Stephanie Tyndall. She is one of our nurse practitioners in our family medicine department. So, hey, Stephanie, thank you for joining us.
Hey.
All right. So
hey,
today,
everybody, all my patients out there.
So today we're going to be talking about just kind of the difference in when a patient should be going to the ED versus seeking care with their primary doctor.
Mm-hmm.
And so I know right now, we're in flu season, and especially with all the different respiratory colds, COVID, RSV. So I kind of wanted to start with that one, Stephanie, and just kind of talk about it a little bit. So especially with the smaller children, because we have lots of parents, grandparents that bring in children and guardians, when should that be a concern for them? That, hey, maybe the baby needs to go to the ED versus coming into the doctor's office.
So it usually, even with adults and children, you have a little bit of a difference there because children can't tell you sometimes like an adult can tell you about things. But, looking at the child, is the child acting abnormal? Are they laying around? Are they not eating? Are they not drinking? Those types of things you would call your doctor's office about. Are they just not feeling well? Have they been throwing up? Did it just start? A lot of times I think parents like to wait until it becomes an emergency, but the best thing to do is to handle it right off the bat. Of course, at home, if it's a low-grade fever, 101, 103 even, try to treat it with Tylenol at home, Motrin, ibuprofen at home. And of course, if the fever does not go down with therapy, then you need to call your provider. If the fever goes up quickly, 105, the child was to have a seizure, those things are considered emergent situations. You would go straight to the ER for that. Breathing issues with children. Now they'll cough. Children have a lot of coughs. And I think, sometimes parents may get a little anxious about that. But if they're not turning blue, if they're able to talk to you, if they're able to cry, they're getting air in and out. But we do know in the healthcare field that respiratory illnesses are our big triggers with children. And so especially this year, we've seen some deaths with the flu this year, unfortunately. And we did see quite a few with COVID. But if your child has shortness of breath, if they have trouble breathing, blue or purple lips, their skin or their fingernails looks that way, especially if the chest and the stomach are rising when they're breathing, we call that a retraction, like it's going in and out. Of course, a seizure, we would definitely want to make sure we took the child to the ER. Any kind of severe bleeding, those types of things, you would definitely want to take them straight to the ER. If you bring them in within 1 to 2 days of the beginning of symptoms, we can test them usually, get them treated, get them on something. We can test here for COVID. We can test for RSV, flu, strep, mono, right here in the clinic today, and tell you if something like that's going on. Ear pain, bring them in to see me. Cough, just a simple cough, a runny nose, a sore throat. A lot of children's immune systems are building. And so when you take them to the ER because they're having these symptoms, then they get exposed to other things. That's where we see the children coming in and have strep and flu because they've picked up something while they were in the ER. Also, it is much cheaper to go to your primary care doctor's office if possible for you to do that. The cost, the wait is a lot less than if you went to the emergency department. The emergency department is for emergencies.
Yeah.
I'm a nurse practitioner now, but I was a nurse first. And I actually started at the hospital in the emergency room as a registrar. I registered patients in and started and got my nursing. And that's where I did most of my work, was the express and the ER area while working at what then was Lenoir Memorial Hospital. And, you commonly see parents who bring in their children for minor illnesses and injuries. And that's what the pediatrician's there for. That's what their health checks are for. Their vaccines. It's important to get those vaccines so hopefully they don't get these diseases that we have. So that was like a big, long answer to a short question. But, basically ear pain, cough, runny nose, sore throat, fever, if they're over a year old, vomiting, diarrhea, eye drainage, bring them to the office and let them be seen. Hives, swelling of the face, lips, eyes, tongue, uncontrolled pain, child, you cannot console them, and shortness of breath, trouble breathing, blue or purple lips, which we talked about earlier, chest or stomach pain or pressure, a seizure, any kind of animal bite, severe bleeding or burn, injuries that need to be sutured, infants who are under 2 months of age with a fever. I don't care what the fever is. If it's above 99.9, you get them into the emergency room, those things. And we'll talk a little bit in just a few minutes about an easier way to kind of think about that and juggle those things in your head. But, it's difficult sometimes, I think, as a parent to know where that line is at. Calling and getting an appointment is difficult sometimes with the pediatrician. It's much easier just to go to the emergency room. But then we cause backup for true emergencies that need care and for emergent needs. So, if we can go to the doctor's office, that's the best thing to do. And most doctor's offices have walk-ins. And same-day appointments, which we do here at Kinston Community Health Center. And so we need to utilize those opportunities and stay out of the emergency room unless it's a true emergency at all times.
Yeah, and I think you made some really good points in there, Stephanie, about that. Too, we just don't know what we're exposing ourselves to when we're going up to the ED. There's so many people that are there that are sick, and you made that point in there. I know you talked a little bit about the fever there, and you covered it for the 2-month-old. But I just wanted to go back to that for a minute because I know sometimes that can be a thing that is very concerning for parents, especially with young children. Mm-hmm. Fever, and when do you decide, do we take them to the ED or do we wait and see if the fever comes down and take them to the primary care in the morning? So could you just talk a little bit to that? Because, we know that fever is part of the body's process of fighting off that virus. So maybe if you could just talk a little bit more on that for them.
So yes, fever is a way of the body fighting off whatever bacterial or viral thing may be going on. In children, we see a lot of higher fevers with viral infections, ear infections, those types of things. The flu A this year has had a very high fever with it. But, pediatric patients are, if they're over a year old, most of the time it can be treated with Tylenol or Motrin. And as a parent, you can go right online now and Google the dosing. You should know, if you're going to your health checks on a regular basis with your child, pretty much what your child weighs. And remember that not every 2-year-old weighs the same thing. Not every 3-year-old weighs the same thing. And so dosing them by age on the boxes of medication doesn't always produce effective responses. And so dosing them by their weight, and you can find that online at Tylenol or Motrin.org. They both have one, is more effective for the patient. Also, one of the things I want to say is a lot of times parents will feel a child and say that child is warm, they have a fever. Be sure to have a thermometer on hand at home. They're very inexpensive at Walmart. Most these days, any thermometer is inexpensive. You can find one, but have a thermometer there so that you truly know if your child has a fever or not, and that you're not just treating them with some medication that they don't need. Sometimes children feel warm, and they don't have a fever, but if they do have a fever and they're over a year old, treat first by weight at home. And if the fever responds, then usually you could just wait until your pediatrician.
That primary
Yes. If for some reason that the fever continues to spike, even though you've given them medication, then that's a pretty surefire way that we need to go on to the emergency room and see what's happening. I know back in the day, 101, 102 was a high fever, but nowadays we see 104 and 105. Now, I'm not saying let your child sit there and suffer. If they're not drinking, if they're not eating, if they've not urinated in 6 to 8 hours, they're getting dehydrated, they need emergency room care. And you can alternate Tylenol every 6 hours, 4 to 6. You can alternate Motrin every 6 to 8 hours. And so you can give both of those simultaneously if needed. But most of the time, the doctor kind of gives you that green light, that okay to do that. But infants with fevers, we do not like to see that. Usually when you have a child and you're discharged after the birth, they tell you if the child has any fever greater than, and they'll give you a number, then you need to call the pediatrician or go straight to the emergency department. But children under a year old, 2 months, especially 2 months and under, any fever, go to the emergency room. Don't sit home and wait for it to become an emergent situation, and then you have to go to the ER. If you feel like that the child is urinating, they're eating well, they're not lethargic, you can wake them from sleep, then bring them on in to us. But if you can't, or if the child's fever continues, like I said, to rise, or they have what we call a febrile seizure, a seizure from that fever spiking so quickly, then that's the emergency room. That's not primary care.
Yeah. Another thing that you were talking about, Stephanie, with the viruses, just kind of to put that out there for a point, some of the things that we do to kind of address that for the patient. Mm-hmm. A lot of times with viruses, it's a viral thing. And so sometimes I know parents come in and they're expecting some kind of medication for that. But there's a lot of other things that we can do to help with that virus. So just let you talk for that for a minute.
So there are antivirals that we can give now. Like for the flu, there's Tamiflu. You have your pros, you have your cons, just like with any medicine. I think I usually give the parent the opportunity and the choice to make that decision. If it's within the window of opportunity to treat with that, and the child is positive, then of course we have Paxlovid for COVID. And if that's within that window and the parent chooses and the age is correct for that, then we can certainly treat with that. Now, neither one of those will cure that virus.
Yeah.
They will only shorten the duration of the signs and symptoms. And I will tell you, with Paxlovid, we do see a lot of what we call rebound COVID. You do feel better, but around day 5, we see symptoms starting to remanifest themselves again. So, sometimes the body has an immune system, a natural immune system. And if it is viral, then it's good to allow the body to fight that virus and to overcome it. Staying well hydrated is very important. Getting rest, enough rest, is very important. Back in the day, I know anybody who can remember, parents used to put you in a tepid bath, is what they called it. It wasn't hot, it wasn't cold, just to kind of cool the child down if there's a fever. Obviously, treat a fever. Have something at home, like we said earlier, to check that fever, and then treat that fever accordingly. Symptom treatment's also another thing. Are they coughing? Are they sneezing? And that's where your doctor's office comes in. A lot of parents aren't sure what to give the patient over the counter.
Yeah.
So when you bring them in, that's the advice that we can give you. You may not get an antibiotic because the child may not need an antibiotic. It may not do anything for them. It won't do anything for them if it's a virus. And so we would just be giving them that for no reason at all. But treating symptoms is important when it's viral. And, we don't always know that it's viral, but that's where we look at clinical signs and symptoms of a patient sometimes, and we can tell that. Obviously, if it's airway involved, if you've had signs and symptoms longer than 7 to 10 days, then yes, by all means, let's get an antibiotic on board and see if that'll help take care of something. But first, we do try to treat the symptoms first without the antibiotic, unless we truly know we've got some pneumonia or we've got bronchitis or something like that we would want to put you on an antibiotic for.
Yeah. And when do you think, Stephanie, that should be a concern for that parent, that maybe this is a little bit more than that common cold going on? What are some things there, like a fever being one,
Right. A high fever, of course. Sore throat. The child is crying and holding their ear. Sometimes when they're crying and they're unconsolable and they're not old enough to quite tell you what it is, a lot of times it can be the ears. A lot of infants teethe and they run fevers with teething. And so, there again, that's what, we say those are not emergent situations. Although you feel like a child with an earache is an emergent situation. And if you can't get into your doctor's office, then by all means, go to an urgent care. Okay. Not the ER, something like, that when it's an earache like that. Also, your pediatrician or your primary care doctor knows you. It's called continuity of care. And if your child has ear infections, let's say, and they're consistent, if you go to the ER, you're going to see a different person every time you go. If you come to your pediatrician and we see a pattern there, then we know, hey, we need to have this child go to an ear, nose, and throat doctor and be evaluated to see if there are further treatments that need to be done. There's a reason the child continues to get infections. And so you have that continuity of care with your provider. Just eyes are a big thing. We see that a lot. Kids will rub their eyes a lot, and it will cause them to swell. But there is also the possibility of a deadly infection that you can get that needs emergent care. But going to your primary care doctor, like I said, again, within a proper time frame can make a world of difference of that. But let me say right now, do not hesitate to follow your instinct, no matter what the child's presenting. Yeah. If the problem needs immediate attention and you truly feel within yourself that it does, then go seek that. But if you can discern which way you need to go, primary care is always going to be your best unless it's an emergent thing. Emergent chest pain, shortness of breath that is sudden and has just come on, a thunderclap, we call it a thunderclap, a quick headache that has come on and it's strong. It's like no headache you've ever had before. Emergency room. A cut where you can see things inside your skin that you shouldn't be seeing. You need to go get that taken care of. And there's a time frame for that. I believe it's 6 hours, within that time frame, because the body begins to heal from the inside out. I've seen people come in here with tips of their fingers cut off to primary care. And I'm thinking, not today. You need to go somewhere else. Also, sometimes your primary care doctor will send you to the emergency room, and patients don't want to do that. But believe you me, your primary care doesn't want to send you there. They're sending you there because they know that's where you can receive the care as quickly as possible that you need. A lot of times in primary care, we don't have the ability to receive results back in a short period of time. It may be 24 to 48 hours, and waiting for that is not feasible. If you come in and your heart rate is elevated and we can't figure out what's going on, or you've had diarrhea and vomiting, ER for sure. If you just aren't feeling quite right and your vital signs are off sometimes, and your history, that's why it's important with that continuity of care again, then we may send you out to the emergency room. But if you utilize the emergency room for primary care, as I said before, you're seeing a different provider every time. There is no continuity there of a provider knowing what your history is and what medications you're truly on. Because I'm going to tell you right now, most patients don't bring their medicines with them to the ER or the doctor's office. And that's important. You should have it where you can grab it and take it if you need it. And most patients don't know. Now, they know the color of every pill they're taking, but they don't know the name or even sometimes what it's for. And so when you get to the ER, it's difficult to provide good care in a non-emergent situation for someone. So, Stephanie, I kind of look at it like a light, a traffic light, a red light, a yellow light, and a green light. So your green light would be when you're just not feeling well. You feel like you're coming down with something. You're more tired than usual. You've got a slight headache. You feel a scratchy sore throat coming on. You may have taken some over-the-counter medicine, and it's just not getting any better. It's time to call your doctor's office. If you have a pain, let's say in your side that is tolerable, but you just don't, it's not normal, call your doctor's office. Just not feeling well is the way I like to think about it. I'm just not feeling like myself. That's your green light. That's your doctor's office. Then you have urgent care. Let's say it's a holiday, your office is closed, or it's after hours, or before hours sometimes. Um, that's when you can utilize urgent care to go. Some urgent cares these days do offer primary care. Um, but I do still preach continuity of care because that's what I like for myself. And then you have those things that just cannot wait for a doctor's office to open up. And urgent care is a good thing. You just can't wait. It's a weekend. You can't wait till Monday to be seen. Your child's had a fever. All this stuff's developed over the weekend. Then by all means, let's get that child into an urgent care to be seen and get treatment started and then follow up with primary care. But now if it's something that's life-threatening, it's an emergency, it's emergent, and we know what those things are. You just, you're having chest pain that is pounding, going to your jaw, going down your arm. You're having tingling and numbness, and that's not the norm for you. You can't keep fluids down. You can't keep food down. You've had several episodes of diarrhea that now has turned to the color of water. The body is depleted at that point. Mm-hmm. You need some fluid. And so, there's ways of knowing. And so you've got a red light, that's ER. You've got that yellow light, that's an option between the ER and primary care when you can't get into primary care. And then you have that green light for when you just aren't feeling well, you just aren't feeling right. I'm running a little fever. And these days we can test for things at home. Sure, go ahead and test yourself at home if you want to, and you see that you have something. But if you're not shaking that, if you're getting that cough, a lot of times we've also seen here recently with the flu that we've seen it turn into pneumonia quite a bit this year, actually. And so if you're just not feeling well, I'm just not getting better, call your doctor's office. But if you're just not getting better because now your chest is hurting and you can't catch your breath, and you're having to bend over to breathe, or your lips are turning blue, or your child's fingernails are blue, or lips are blue,
Yeah.
ER. So, some of it's just, I want to say common sense to know, but I always like to go with that traffic light theory of green, yellow, and red. And if it's something that's happened all of a sudden, like, oh my gosh, I just cut my finger in half, that's an ER,
Yeah. And I think that's such a good way, Stephanie, of remembering it, and kind of looking at and making that decision in there. So, I think that was very helpful. I think, the patients will appreciate this information and just, being able to put it into play when situations come up at home and trying to make that decision. I know you didn't mention.
If you ever wonder, call the doctor's office and ask what you should do. Yeah.
Absolutely. And we have nurses or medical assistants that can talk with the patients about it. I know you mentioned, but just kind of reiterate that we have same day appointments. We will certainly try to work a patient in if we need to try to keep them from having to go to the ED. And then after hours, if it's something over the weekend or late night and there's nobody here in the office, we do have an after hours answering service. You're able to get to a licensed nurse who has direct contact with the physicians, and so she can give you some advice. And of course, if it warrants reaching out to the provider, we have providers on call who can take those calls and talk with the nurse about that. And so thank you so much, Stephanie, for being with us today and just kind of going through this. And is there anything else you wanted to add in?
No, I don't think so. I think, like I said, important thing with children is to keep their health checks, keep their annual wellness visits, keep their vaccines up to date. Remember to wash your hands. That's the best thing you can do.
Yes.
If you are sick, be aware of others. Try to stay home until you are better so that you're not spreading the love around to people. And be well. That's it.
That's great. Thank you, Stephanie. And thank you to our patients for joining us for this podcast today. And we look forward to talking to you again soon.
Yep. Thank you, Stephanie.